thank you so much for joining us this morning for today's webinar as we hear from the authors of the new book titled Learning from 50 Years of Aboriginal Alcohol Programs Beating the Grog in Australia. So my name's Cat Giorgi and I'm part of the team at the Foundation for Alcohol Research and Education. And in a moment, I'll introduce you to Nicole Hewlett and Peter Dabbs. But first, I'd like to acknowledge the Ngunnawal and Ngambri people as the traditional custodians and owners of the lands from which I'm joining today. And I'd like to pay my respect to elders past and present and extend that respect to all First Nations people who are joining us online today. I encourage you to write in the chat the names of the lands that you're joining us from today. I'd also like to acknowledge that we're coming together today with a variety of lived and living experiences, including experiences of alcohol harm. So please take care across the next hour, and we'll be posting helplines in the chat as a reminder that there are supports available. Now I'm going to introduce our two speakers who, as I said, are the authors of the book. So I'm joined by Nicole Hewlett, who is a proud Palawa woman with experience in knowledge translation in closing the gap policy areas, including alcohol, tobacco and other substance use in pregnancy. Nick is an absolute legend, which you will learn across this next hour. And we're so lucky to have her here joining us today. And alongside Nicole is her co-author, Peter Dabbs, a sociologist with extensive research in alcohol and other drug policy and program evaluation. And Peter was also once a director of the board here at what was the AER Foundation. So thank you, Peter, for joining us here today, another legend in the field. So just a reminder that if you do have questions, please pop them in the Q&A box and we'll come together and answer those questions shortly. But now I'm going to pass over to Nick and Peter.
Thanks, Kat. And we're going to just bring up our slides, which is going to be seamless, isn't it?
Leave us. Yes.
Yes. Is that on? Can you see that, Kat?
Perfect.
Perfect, excellent. So we want to hear. So yes, I'm Nick. I'm a very proud Palawa woman from Little Witta, Tasmania. For those that are overseas, that is a little island at the very bottom of Australia, a very cold island, which is why I am on Turrbal and Yagara lands of Meanjin in Brisbane with Dabbs here. And we too would like to pay our deepest respects to the traditional custodians of these beautiful lands and these waterways, and acknowledge that we have always stood in footsteps millennia old, and we would like to pay our deepest respects to elders, both past, present, and the ones to come, and acknowledge that the spirits of this beautiful land also held the spaces and influenced the writing of this book on which we wrote it on. Dabbs, did you want to introduce yourself briefly?
No, I think enough. I wasn't going to add anything to what Kat said about me, and you've just said about us, Nick. So let's go straight into the program. So let's So just a quick overview of what we're going to try to get through in the next little while. We'll talk a little bit about why we wrote the book. And then we're going to talk about what's in the book, of course, and then including key findings from the book, and then we'll finish up with some what we think are sort of take-home messages, a little bit of information about where you can find and read the book itself, because we can't summarise a whole book in this next presentation. And just a little proviso there that we will be showing one image, which does have some deceased people. It's an image from 1989, I think. But as I say, we have permission from the NPY Women's Council with the source. Okay, let's go. So yeah, the background to the book is that it's approximately 50 years since a century of legal prohibition on Aboriginal people possessing and consuming alcohol was lifted in the various Australian jurisdictions. And since then, of course, an enormous number of different kinds of programs and policies have been tried, but there's been surprisingly little cumulative evidence coming out about what works and what works under what conditions. So, and yeah, so and a lot of the information that is available is in fact disappearing. It's disappearing partly because much of it was only grey literature in the first place, reports to government agencies, for example, and also a lot of it is precedes the digital age. So there's evidence there that's disappearing. There's also a question about what actually constitutes evidence, and I don't know, Nick, you might want to add something about that.
And I think that's probably one of the main things that drew me to this book, as well as, you know, working with the mighty DABs, was, you know, when we were sitting on an NHMRC alcohol working group and discussing all the evidence out there around alcohol harms, etc., it occurred to me that we do heavily rely on, you know, what is in the written evidence, and like, you know, rightly so, that's what we need to do. But for our people, we haven't been writing this evidence. Like, the evidence that our people, how we store evidence is in our minds, and we translate that and share that orally. So where is that captured? And it occurred to me, you know, in a pretty profound moment one day, that we're not informing this evidence base, and yet everything is, you know, grounded in evidence-based practice. So it's going to be, you know, anything that forms around that evidence is made about us, without us. And then when Dab said that we need to look back at, like, well, how has Aboriginal people captured evidence? And it's been through grey literature reports. And they have been, you know, the incredible amounts of knowledge in these reports that are often put to the side because it's not considered worthy enough, valuable enough, robust enough. And yet there is so much in there. There's so many layers, because when solutions and knowledges are shared from our community, it is very strength-based. It's very solutions-focused and culturally inclusive. And that's not just for our culture, but all cultures. That is inherent to Aboriginal peoples in Australia. So when we had this opportunity to bring Aboriginal voices and privilege and prioritise Aboriginal voices into the evidence base, it was, you know, an irresistible opportunity, and it's been such a privilege to go on this journey with Dabs, who has, you know, all of the knowledge of, you know, the past 50 years, which has been phenomenal to, you know, witness his brain in action. So that was a large part of why I've loved this entire journey.
Okay, well, my head's now probably so swollen, but we won't go into all that. So just a quick overview of what's of the main topic areas that are covered in the book, and we will say a little bit about each of them, but just to explain what they, or to quickly run over what they are. If you start at the sort of top of our magic wheel there, we begin with a section about the various ways in which Aboriginal alcohol issues and Aboriginal alcohol use have been conceptualised and talked about, because these, of course, underpin the various approaches to trying to reduce harms. I think it's an important part of the book. We're actually not going to talk about it today, partly because if you start unpacking these various frameworks, you know, we'd use up our entire hour and not talk about anything else. And then the rest of the other sections in the book, fairly sort of, I guess, an orthodox way of breaking down the various kinds of programs, but we talk initially about both prevention, primary prevention, and early intervention. We then look at the area of treatment and rehabilitation. We've then got a section or a chapter which looks at the various community-based restrictions on availability. And then another area we look at is as licensed clubs in remote communities and permit systems. We then have a section on what's a particularly important area, of course, and that is preventing and FASD and diagnosing and providing support to families with FASD. And then the final section in the book is looking at community policing, in particular focus on community patrols and night patrols. Probably it's worth noting that one area that we don't look at in the book is the sort of law enforcement based, often quite punitive approaches, because our focus is on community-based interventions. Yeah, okay. So just starting then, and as I say, for part of this presentation, we're going to pull out, some of the key findings without being able to go into much detail on any of them. So beginning with primary prevention, or preventing or delaying the uptake, that should be uptake, not update there, sorry about that, of harmful alcohol use. So programs like education programs, media campaigns, awareness promoting campaigns, and so forth. And historically, these have been popular with governments, despite not too much evidence of effectiveness really anywhere. And in this case, there's very little evidence of outcomes from these programs, but that's not necessarily proof that none of them worked, because there's also been very few programs have been evaluated at all, and even fewer have been rigorously evaluated. So the evidence base in this area is pretty thin. But what does come through, both in Australian studies, and we also looked at programs involving First Nations communities overseas, and there are a number of factors that tend to be associated with positive outcomes. One, and this will come through again and again today, is the importance of community leadership, the need for strategic partnerships and coalitions, the need for a multi-component approach, not relying on any one program, the importance of having good data, both baseline data and data to show whether you're being effective or not, programs that promote cultural connectedness, that's an ingredient of successful programs in general, the importance of limited, clear, and widely supported objectives, and finally, recurrent rather than one-off initiatives. So all of those factors are associated with positive outcomes in this space. Looking at early interventions had a somewhat different history, in that for a long time it was relatively neglected in Aboriginal settings, that the emphasis tended to go on primary prevention, as we've just seen, or on residential treatment. And this was despite the fact that in sort of mainstream populations, there's high evidence of effectiveness of screening, brief interventions, and a sense, I suppose, that developed that there were particular opportunities in First Nations setting, in primary healthcare settings. So in recent years, there has been a lot more attention given to screening and brief intervention. With government, for example, I think from 2017, the Commonwealth Government stipulated that community-controlled health service providers had to do regular screenings with the Audit C screening. And so there has been progress in recent years, but there are also some very real barriers, which are not unique. Well, some of them are unique probably to Aboriginal settings, and some of them are not. One, which is certainly not unique, is the sense that there are competing demands on health practitioners' time, a sense that this is not their sort of primary duty. Another factor is we said there, the episodic and group nature of a lot of Aboriginal drinking, that the pattern of heavy drinking in binges and then long periods of not drinking at all, it becomes very difficult to say, well, what's your typical drinking? What's your typical consumption? and the fact that people often tend to, pool their money and buy in drink in groups, it can be very difficult for an individual to say how much they consumed. Another factor which kind of dogs efforts in this area, well, there's one is the reluctance of health providers to question people about their drinking, and also a perceived and often a very real lack of referral options. A sense there's not much use asking somebody how they're drinking if there's nowhere to refer them to. So yeah, a mix of progress, slow progress in that area. The area of treatment and rehab, which historically has been a very favoured area for Aboriginal people and communities, for really since the 1970s, when I think the early 1970s, the first residential program was established in New South Wales, and that first program utilised the 12-step abstinence-oriented 12-step AA-informed program, and that became the dominant model for residential treatment throughout Australia for Aboriginal programs, and to a significant extent still is. But in more recent years, there's been also a growth of healing programs designed to address intergenerational trauma and drawing on Indigenous cultural healing traditions rather than relying exclusively on what is, after all, the whole AA model originated in the United States. So yes, there's been a growth of healing programs, which usually combining with sort of Western style psychotherapies. A number of issues have recurred in this area. One is a sense that particularly with the dominance of the AA programs, 12-step programs, that offered a very limited range of treatment options other than abstinence. There have long been issues about governance of these programs. There has been and continues to be an issue around resourcing, providing adequate resources. You cannot have a stable, trained staff if they're not adequately resourced. Another factor is the often very complex needs of people presenting at these programs, which in turn necessitate different kinds of intervention, and they in turn create problems for evaluation, because if you've got multiple components, then methodologically it's actually quite difficult to work out what's having what outcome. But it also raises this other issue that we'll probably return to, and that is the need for not just, if you like, mainstream criteria and evaluation priorities, but also Indigenous priorities and understandings. I don't know whether you want to add to that, Nick, that.
Well, I suppose it's even we have struggles around, say, close the gap policies and things like this, because often the targets are not determined by Aboriginal peoples or even let alone by the local community that is participating in the evaluation. And I think this speaks to the point we touched on earlier around how do we privilege and prioritise Aboriginal voices, because if we set the targets in accordance with what Aboriginal people felt was important to evaluate, then I think we would have completely different evaluations than we do now. But often it is, as Dabs touched on, set by non-Indigenous funding bodies of various kinds, governments, and therefore you're only evaluating what is their agenda as opposed to, what many of the outcomes may be evident. So I believe that there's probably many programs that have been, very successful, but we've been looking at, we're measuring how many pears fall off of an apple tree. So, and I think that's where a lot of the challenges have stemmed from.
So shifting focus now, another area that we look at in the book, and we can, as I say, only talk a little bit about here, is this idea of having community-based restrictions on alcohol availability. Excuse me. And these really, they originated, well, there were really two factors that led to their emergence. One was the emergence of the public health approach to alcohol problems, which emanated particularly from WHO in the 1970s, I think, which, in addition to the sort of existing clinical kinds of programs, stressed the need for controlling supply and also a focus on populations rather than individual drinkers. So that approach emerged, as I say, in the 1970s, and quite a lot of the people working with the then new community-controlled health services, for example, were well aware of that sort of approach. But it emerged around about the same time as, particularly in Central Australia and particularly amongst women in communities who were, first of all, on the front line in terms of bearing the brunt of alcohol-related violence and injury and so on, and also became increasingly fed up with the outlets that were fueling this kind of these harms. And so they began to mobilise, and the little photograph up there is from the NPY Women's Council, which shows one of several major sort of demonstrations where, in this case, women in 1989 marched down the Lassiter Highway to demand either the closure or the roadhouse outlets that they stop serving Aboriginal people from their communities. So there was a major mobilisation which combines, as I say, with this public health approach. And we go into some more depth in that in the book. In terms, however, of going to the outcomes, and then, of course, the best known examples were from Tennant Creek, the famous Thirsty Thursday, where the Jalalakari Association led a campaign to have takeaway sales stopped on Thursdays, because in those days most of the Centrelink payments came in on Thursdays. So there's fairly strong evidence, actually, that where these initiatives are community-led, and they're not all community-led, but where they are community-led, they actually have quite a good track record in reducing harms, reducing violence, reducing consumption a bit, but it's more the harms that they make a very significant impact on. And despite what some people would have you believe, they actually do enjoy widespread community support. However, they also face a number of issues, the first of which is, of course, that the liquor and hospitality industries don't like them and will put enormous pressure on to resist and stop them. And partly for that reason, politicians tend to be very nervous about supporting them as well. So they struggle for support. But anyway, that's probably all we'll say about that right now. Another fairly contentious area, I suppose, is this whole issue of this kind of if you can't beat them, join them approach of having community-owned liquor outlets, which a fairly small number of communities have gone down this path. The rationale for doing so is, as we've set out there, the idea of having a community-owned licensed outlet, usually in the form of a licensed club, is first of all that money that was otherwise going out of the community stays in the community. It will foster these outlets will foster moderate drinking and even a family-friendly drinking environment. that they will reduce the flow of people into towns with all the attendant sort of issues arising from that, and that they will put an end to grog running. Historically, there's fairly clear evidence that most of these outlets have not achieved most of those objectives. They've probably been fairly successful in keeping money in the community, although it's actually money in the licensed club, so it's debatable whether that's been a huge benefit. They haven't fostered moderation. They have, and there is evidence to show that they don't actually reduce the flow of people into towns or eliminate grog running. And on the contrary, they've in many cases been associated with not so much the sort of binge drinking, but a chronic heavy style of heavy drinking and fairly high levels of harm. But and so there's a kind of tension that there are issues that come through in all of these clubs, and they are firstly the tension between promoting moderation and ensuring commercial viability. The fact that the drinking cultures in these communities are often fairly heavy drinking cultures, and so rather than the licensed club adapting, changing people's drinking cultures, the drinkers change the licensed club to their drinking culture. There's a history of management difficulties. Running a licensed club in the community is hard work, it's difficult, and quite a few communities have actually run clubs for a while and then actually shut them down, said no, it's just too hard. One of the things that we bring up in the book, I think, is that also there's clear evidence that governments have failed to provide the kind of support that they should have to these management, boards of management of these clubs. If you're going to, it's one thing to encourage a community to establish a club, but they will almost certainly need help in managing the outlet. However, there are a few cases where they have been fairly successful by, I think, any criteria. And again, there are a number of issues that emerge as what we call enabling factors. So one is there has to be widespread community support. And that's sometimes not easily attained because alcohol is a very divisive issue in communities. A second is there needs to be genuine attentive regulation by the licensing authority, not an out of sight, out of mind attitude, which I think has sometimes been evident. There need to be good physical amenities, responsible serving practices, and clear eligibility and exclusion criteria. But where those are met, then they have tended to be quite successful. There's another kind of control policy which is not widely used, and that is the idea of having individual liquor permits. So if you've got an area where alcohol is either heavily restricted or banned, the idea of a permit system is that approved individuals can bring in liquor and drink it under certain conditions where others are not permitted to do so. Once upon a time, this was actually a major alcohol policy actually in Scandinavian countries, and it was also used for a long time in Canada. It's not widely used anywhere today. However, there are about, for example, I think at last count, about 20 communities in the Northern Territory. It's written into the Liquor Act provision in the Northern Territory, and also in Nunavut in Canada. It's a major sort of means of controlling alcohol use, a community-based means of controlling alcohol use there. There's very little evidence of outcomes, little evidence, and what evidence is pretty inconclusive. But there are a number of issues and themes that come through so that we can say, I think, that where, and again, a little like the management issues are critical. If you've got a community-based permit system, you need a permit committee to decide who gets permits and who gets their permits taken away. They need to be adequately supported. It's hard work. there needs to be at least a reasonably effective way of controlling grog running, otherwise the permit is fairly meaningless. And there needs to be enough community support so that the questions about who does and does not get a permit is seen as being a legitimate expression of community will. Another factor is remoteness. We haven't put it in there, but permit systems tend to work better in remote settings.
And when it comes to addressing fetal alcohol spectrum disorder, I suppose all of the chapters and what is enabled in those chapters all comes to head, I suppose, when we look at healing the impacts of particularly unsupported fetal alcohol spectrum disorder. So in Australia, we don't have a wider community prevalence, but we do have a prevalence that was done in Western Australia among Aboriginal and Torres Strait Islander people there. And because of that, like many countries, there is a societal attitude that FASD is an Indigenous problem, but it's just better disguised in non-Indigenous populations. Where you have drinking, you will have, fetal alcohol spectrum disorder. Our community leads this area, and that stems back from what Dabs was talking about earlier around when our community hear about something and there are vulnerable members in the community that look to have further vulnerabilities or trajectories of those vulnerabilities exacerbated, we mobilise, and that's usually we mobilise, our women mobilise to do something about it, to make sure that the harms are reduced for those most vulnerable in the community. And June Oscar is well known, as well as Emily Carter for leading that. And June Oscar was just the outgoing Social Justice Commissioner, a phenomenal person. And she led up with Emily Carter and many others this prevalence study, as well as community program over in Fitzroy Valley to address FASD. And the effectiveness of it stemmed from the fact that not only did the community lead those programs and those strategies, but they governed it. So they were the ones that decided who was best and who was most appropriate to be involved. They had, even health professionals. It wasn't enough for health professionals simply to fly in and out. They insisted that these health professionals stayed in the community. They got to know the community, and they had to stay there for at least 2 years. So to be part of the rhythm of that community and have established relationships in that community. So these were very well governed according to Aboriginal ways of knowing, being and doing. So we weren't just led, we were governed in these FASD initiatives. And it also was holistic. So it wasn't just about, focusing solely on FASD. It looked at, the broader issues around, well, what in the context of history and the structural racism that our people are up against, what roles do those sectors play? So it also involved police, law, justice, housing, social sector. So there wasn't just this one focus on, let's just diagnose as many people as possible to see and get an understanding of the issue. Mob over there understood the extent of FASD. What they needed was those referral pathways and a holistic approach to how can we support the community healing, both those with FASD. So what does that look like? How do we support them in a way that is strength-based and supports the strengths that they bring and how they can meaningfully contribute to community and what needs to be put in place for that to happen, as well as how do we support women to have an alcohol-free pregnancy? And if they can't, if trauma is coming up, what does that look like? How do we support them anyway and walk alongside these women to reduce the impacts of alcohol during pregnancy? So it addressed, it always addresses, all of the social, historical and the cultural determinants of health in terms of, how do we heal the impacts of FASD? And it required also the government to support appropriately, to know where to let go of, power, control, and where to amplify the voices of those living and breathing that community, and allow that community to lead and to inform the government what they need from the government. So that is another massive shift in how we can have effective programs, and the effectiveness of that Fitzroy Valley program is ongoing, and it is sustainable because it was born from community for community, and so it therefore respects community and the local ways of knowing, being and doing.
So the last sort of distinct program area that we look at in the book is, as I said before, community policing, which has an interesting and probably unique history. In that the first patrols were actually unfunded initiatives in pretty remote communities, very much under the radar. They came about because people in those communities, and they were led by elders in the communities, who wanted to utilise their own cultural traditions, their own conflict resolution traditions and so on, to address some of the troubles associated with alcohol, either in the absence of policing in some cases, or as an alternative to what was felt to be inappropriate policing. So these little programs started away, as I say, they were completely volunteer activities. There were no government funding. The first one that's I think recorded as having been documented, and it also started out with no government funding actually, and that was the Jalalakaria program in Tennant Creek, started in around 1991. Again, it was about trying to utilise culturally appropriate people and traditions in order to, prevent conflicts expanding or exploding, and to manage those that did occur. But with the Royal Commission into Aboriginal Deaths in Custody, patrols came very much into the focus. The Commission was impressed with these initiatives in community-based policing, and considered that they were an alternative to, again, what was often felt to be a sort of heavy-handed, punitive style of policing. So they got a big wrap-up in the Royal Commission, and they then kind of they developed all around the country, and in remote communities, in regional towns, and even in sort of metropolitan areas. So suddenly they were everywhere, but they were by this time getting some government funding, although it was usually inadequate, short-term, sort of hand-to-mouth type funding. They often had a mix of sort of voluntary and paid staff. There was a further big change following the 2007 Northern Territory intervention, because one of the things that flowed from the intervention was a decision by the Commonwealth Government that firstly it would increase funding to patrols. It brought them all under the authority of the Attorney General's Department, which struck many people as a fairly odd move. They didn't have experience in this area. But it also, along with the extra funding, came a high degree of government control. And one of the spin-offs of that since then has been, in fact, a decline in community involvement in many of these patrols. So, a very mixed blessing indeed. And if you're looking back over the experience of these patrols, there are a number of issues that have been quite widespread. One is this whole issue of conflicting expectations, that the patrols themselves usually don't see themselves as a kind of drunks taxi service, getting drunks off the street, to put it in fairly crude terms. They're much more proactive. They see themselves as having an outreach role, as I said before, in preventing conflicts or managing conflicts. So that's been a tension, particularly in the more urban settings. And the other issue, as I've already mentioned, is what effectively has become probably excessive government control. So what are the enablers for these patrols? Well, again, genuine community ownership, not just being based in the community, but controlled by community. A genuine authority, an opportunity for elders and other respected people to exercise authority, and then clear resourcing, clearly defined roles, clearly defined and mutually acceptable expectations with police and other stakeholders, and finally adequate training and staff development. Okay, so they're the main areas that we look at, and then moving on to what we see as some of the take-home messages that I think come out of the book. One is that all of these programs can work. They're all potentially, and they all have, evidence base to support them. Whether they do or not depends as much on the processes and the relationships through which they're developed as on the programs themselves. So again, and we're probably sounding a bit like a broken record with the importance of community leadership, although we'll qualify that a bit in a few minutes. But there needs to be a strategic combination of programs, not reliance on a single measure. But there needs to be adequate and appropriate government support. Communities can't do this by themselves in general. They have limited resources, and sometimes they face very powerful opponents, the vested interests, who do have an interest in harmful alcohol consumption. So there needs to be a genuine partnership. There need to be appropriate interpersonal and interorganisational relationships underpinning them. And again, the point we've made before, that whatever monitoring and evaluation that is done incorporates local Indigenous knowledge and priorities.
And on that note, by incorporating and embedding and prioritising Aboriginal knowledges and languages, we have an opportunity to reframe the narrative. Most of what's been written about our people has been from a very deficit-based approach, which, stems from colonisation. A lot of the bias and the narratives that are underpinning these decisions and these policies are still to address the Aboriginal problem, which it's always been the underpinning message underneath all of the policies that have been made since colonisation began. It might be rebranded as different things now, but it's still involving, it's about us without us. And by doing that, we look at how we're addressing the things that society considers, unwelcome in terms of, behaviours, without having any compassion and contextualising that in history. So we need to move away and reframe the narratives around defining, what is a problem, which is typically defined by the dominant culture, the non-First Nations peoples, to understanding alcohol issues as a set of needs that need to be addressed and can only be addressed and looked at and prioritised by Aboriginal individuals, organisations and communities that are seeking to address these things. The dominant discourse has framed alcohol use by our people as, like I said before, a problem that arises from some kind of genetic failings within us, or that we're some sort of threat to social order, the safety and amenity among non-Aboriginal people. And you only need to have a look at our incarceration rates to understand how that narrative plays out for our people. And it generally leads to, imposed priorities, imposed programs and outcomes that really, as we've said there, satisfy no one.
just come back a little bit on this theme of the importance of genuine partnerships. I think there is a historical tradition of governments either neglecting or micromanaging. And I think one of the points that comes through the book is that it's really important that governments and government agencies avoid either of those. There is a way of supporting communities in a partnership rather than, as I say, either neglect or micromanagement. And there are too many examples in the book of that kind of micromanagement, some of which we've talked about today, the community patrols, some of the alcohol management plans, but we're running out of time, so we won't develop there. Just a few, I guess, sort of wrapping up pointers. First of all, please go and look at the book. There's the link to it. You can download it chapter by chapter. You can download it as a single PDF file, or you can buy at very modest prices softcover or hardcover editions. The project, the preparation of the book was funded by a grant from the Northern Territory Northern Territory Primary Health Network. It's been a long morning. Through the Menzies School of Health Research. The artwork that we've used in this presentation and in the book is by Delvine Cockadoo Collins, who is a very great artist located over on Minjerribah or Stradbroke Island. And what else do we want to say? Oh, yes, and we want to thank FARE for hosting the seminar, School of Public Health here at UQ. We won't talk about the IT issues, but thank you very much for attending, and I hope we've left some time for discussion and questions. Thank you.
Okay, so I'm going to ask firstly, this is a question from Rod, and this goes to a point that you were making, Peter, around industry influence. So Rod speaks about how expecting our governments to give support will never occur because of the alcohol and gambling lobbies' direct access to governments, and that there is a federal government report in the wings about online gambling, and look at what's happening now and all of the advertising. I guess generally, Peter, if you could speak to industry influence and how that prohibits progression of policy in this space.
Oh, look, I mean, you know, where do you start? I think, of course, we can feel dismayed at both the obvious and the very subtle influence that vested interests and, you know, we all know the alcohol industry. Well, I'm not going to even start on the gambling industry, but the alcohol industry, yes, it's extremely powerful. I think, however, we also, to me at any rate, it's essentially, that's a political issue. There are probably some times when you can ally yourself with sections of the alcohol industry, but there are many times when we have to try to combat it. But I think it's important not to sort of completely throw in the sponge. I mean, you know, the political issues, power is very important. The alcohol industry has a hell of a lot of it. Our political system is very, unfortunately, is very vulnerable to lobbying and control by vested interests. But we just have to keep, you know, that's the world we live in. And we do get some wins. So yes, I think it's difficult, but I think we have to just keep going.
Did you want to add anything on that, Nick?
No, just that I agree that, you know, it is very easy to lose hope, but there are also, you know, important stories that are happening where we win, you know, and as you know, Kat, the alcohol labels on alcohol products is one of those. And I think the more that we're strengthened by that and we leverage off that, the more that it will give us motivation to keep going, because otherwise it's the easy way is to sort of give up and be like, it is all too hard. But the impossible, you know, remains impossible until it's not. So, you know, I do believe that, you know, it's always going to be little baby steps, and they are frustrating steps because they are so small, but we will get there.
Yeah, I think that's a really important point, Nick. And without hope, there isn't a movement. So we have to remain hopeful. There's a question here. So I'll come to you first on this one, Nick, from Jessica. So in terms of the issues that have come up, community-led healing programs, do you have any examples of how Aboriginal-led services have or could address these issues? And the issues that are flagged in this comment are limited treatment options, governance, resourcing, staff training, evaluation challenges.
So in terms of, there are cultural camps that go on all over the country in which, a lot of community do it off their own back because they can't get resourcing, they can't get support. At the moment, we are like one small community in New South Wales has asked us to evaluate their cultural camps, but evaluate it in a way that is governed in nation building. So it's all about Aboriginal people determine the outcomes. We don't come in with a particular framework of what we think we expect to find. We come in with the openness to learn from the community around, well, what have they found has made a difference to them, and what do they find has been important to their well-being through these cultural camps that have occurred. And healing, when we say cultural healing looks so different in every single community. We've got another, healing-informed awareness raising, around FASD at the moment that uses humour as a way of healing. So, it doesn't have to be cultural camps and everything all at once. It can simply be aspects of healing informed that really build the capacity of the community to understand how they can meet their needs even when resources are not available. Because there are so many, skills and beautiful ways that our community engage in healing practices, and they often do it off their own back, but just because we don't know about it doesn't necessarily mean, it's not happening and that we are completely maimed by the fact that we don't get any resources. But imagine if we did get resources, gosh, then, everyone would know, just how incredible. And I imagine the benefits would be to many other cultures as well.
Can I just put a bit of an alarm message in here? We've just had the things coming across the screen of our laptop that we're using that the battery's about to run out. So if we do, I'm really sorry. Technologically, this has been a terrible time. But anyway, so if we do suddenly get shut off, then I'm really sorry. But I just wanted to add also. Sorry?
Let's see how we go. I've got a couple more questions, so let's see if we get through. The next one is, are you aware of any data related to a correlation between community-based alcohol restrictions and an increase in illicit drug use? And that's a question from Michael. Okay,
the short answer from me would be no. I'm not aware of any. And it doesn't mean it hasn't happened, of course. I'm not aware of any instances where alcohol restrictions have demonstrated an increase. I think it would be very difficult to demonstrate that, partly because levels of illicit drug use, of course, are much more poorly documented than levels of alcohol use. You'd really have to factor that in at the beginning of any program, and even then it would be fairly tricky. So no.
And another question that just says from Sandra, minimum unit pricing, ?
Like sort of taxation measures, we haven't tended to look at those because they're not by definition community-based measures. They are, very much governmental top-down. So there is a limited evidence out there about minimum unit pricing, and there has been, of course, some material coming out of the Northern Territory. I think at the moment the evidence is perhaps not convincing, but no, we haven't even looked at that area because, again, we ruled it out of scope for what we were looking at.
Thank you. So before we wrap up, I'd really like to just give you both the opportunity to have one final word to leave with people before they leave today. I know you had 3 great takeaways. but I might go to you first, Nicole.
For me, we have such an opportunity and a book of absolute hope here in terms of we've now brought in Aboriginal voices into the evidence space. There are pathways there that can be used in order to inform decision making. I really hope that people use it. There are, so much, so many decisions being made out there that are just, they are misinformed, or they are guided by personal agendas, ego agendas, whatever agendas it is. It's not the agenda of Aboriginal people. And the consequences of that is that our people don't just suffer from those, we die. We don't get the privilege of just suffering from poor decisions. These things do kill us. And I think I never want to sanitize that in any way, because that's the realities of our people. So there is a seriousness to this book as well, that we need these books. We need to start doing better, because at the moment we're just perpetually repeating some cycles, and that is really evident in the book, how many cycles we go over and over again, and that's because we don't have Aboriginal people at the centre of these decisions and of these policies and programs and initiatives.
And look, I think I would just add that it's really saying the same thing slightly differently, that it's really important the failures and the problems are very visible and constantly, of course, rammed down our throats almost. But it's really important not to give up hope. And often, of course, the success stories are very quiet success stories. And we need to recognise that. So, and I think I think our book does demonstrate that there have been, big and small successes, and so we keep going. Yeah.
Onwards and up.
Well, thank you so much for the presentation today. I'm glad that your laptop stuck it in there for this whole hour. I really want to, I've seen you present and share the information from this book a couple of times, and I just feel really grateful as someone who's working in alcohol harm reduction to have this resource. We're dropping in the chat right now a link to the book, which people can download for free or purchase a hard copy of. We've also got a link to a Croaky article, which summarises how this book came about, how this partnership came about, which is a really beautiful piece as well. So we encourage you to take a look at that. We'll circulate these links as well after this webinar so that you have them in your inbox. And so thank you so much for joining today. Thank you so much for gifting us with this incredible resource to help us in our harm reduction work, and for taking the time today, Nick and Peter, for joining us. And thank you to everyone who joined us online as well. Okay, we'll
Thanks,
see you
everyone.
later.
And anyone, comments are welcome. I think we've put our email addresses on the last slide there. So, yeah, feel free to get back to us with any comments or criticisms or whatever.
We welcome it all.
All right.
So
thanks, everybody. And thank you, Kat, for being a terrific
As
chair.
always.
Kat, what's the word? Coordinator.
Facilitator.
Facilitator. That's it. Yes. All right. Bye.
Thank you. See ya.